Every profession has its hazards, including the nursing profession. I'm Nurse Sarah with RegisteredNurseRN.com, and in this video, I'm going to go over the 5 biggest health hazards of the nursing profession. Job hazard number 5, combative patients. Now, in the nursing profession, if you spend any time working on a hospital floor, you are going to encounter that aggressive, combative patient. And patients can become aggressive or combative for various reasons. Like, number 1, they are under the influence of drugs, or they're having like a medication reaction, or they're just really sick. Maybe they have an electrolyte imbalance that is causing their neurofunction to be altered, or they have a mental disorder. And the reason combative patients are a job hazard is because they can physically injure you. And one story that really comes to mind is that I had witnessed this patient who was high on drugs, and they had the patient restrained. And what happened was that this patient had developed this like superhuman strength and had broke the restraints, ran out of the room down this huge long hall naked. And in order to actually stop the patient, a male nurse in a sense had to clothesline the patient and take the patient back to the room. And after everything was said and done, the patient didn't even remember doing that. So this is something that's definitely a job hazard for nurses. Job hazard number 4, sharps injuries. The CDC estimates that there's about 385,000 sharp-related injuries annually among healthcare workers. Sharp injuries can include anything from needles to scalpels to any other sharp object that you may encounter in a hospital or healthcare setting. And unfortunately, as a nurse, I have been a victim of one of these job hazards. And the sad thing is that you can try to do everything right in how you deal with sharps, you're really careful, but you can't control how other people around you dispose of those. And that is really related to my story. What happened was that I had a patient who I needed to transfer to another area of the hospital. So I'm gathering all the patient's things up. I go into the medication room to get their medications out of the cubby, put them in a bag, and have the patient on the elevator. I'm holding the bag of medications. And I notice as I'm holding the bag, something sharp is poking into my leg through my scrubs. And I look down and it's an insulin needle. And I'm like, what in the world? And what had happened was that whoever had provided care to that patient before me didn't dispose of the insulin needle correctly. And the patient had an infectious disease, so I had to go report that and go through all the testing for about 6 months, and luckily I didn't catch anything. So this is definitely a job hazard for nurses. Job hazard number 3, toxic substances. As a nurse, you're going to be coming into regular contact with toxic substances like radioactive equipment or dyes, drugs, cleaners, and so forth. And as a nurse, you've got to always be aware of your surroundings and how to handle those toxic substances. And again, this is something I have encountered in the nursing profession. I was working in the stress lab and we were doing the stress test. I gave the cardiovascular agent and the nuke tech, followed in through that and gave the radioactive tracer, and the radioactive tracer actually got squirted on me. And at the time I was pregnant with my son, and luckily nothing happened. My son's okay and everything like that. But as a nurse, this is something you're really going to encounter, and we give drugs a lot of times, and a lot of these drugs are very toxic, like chemotherapy agents, any patches, creams, things like that, like nitroglycerin, narcotics. You have to be very careful in handling these. Job hazard number 2, musculoskeletal injuries. As a nurse, especially if you're working in a hospital on a floor, you are going to be lifting and turning patients throughout your shift. In addition, you're going to be up and down that hall, walking on that hard floor, bending, turning, doing everything. And this causes a lot of strain on your legs and on your back. And according to the CDC, rates of musculoskeletal injuries from overexertion in healthcare occupations are the highest among all U.S. industries. The single greatest risk factor for overexertion injuries in healthcare workers is the manual lifting, moving, and repositioning of patients, residents, or clients. And the number 1 job hazard in the nursing profession is encountering infectious agents. So if I were to take a poll among all the nurses in the world, I would probably say that about 99% of them would report suffering from this job hazard. even if it was something as simple as the common cold. And the reason I say this is because during my first year of being a nurse, I was sick all the time. And I remember asking the other nurses around me who had been nurses for a while, I'm like, did you suffer from this same thing? Like, you're sick all the time during that first year? And they're like, oh yeah, what's going on with you is that your immune system is just building up and getting strong, and like now I never get sick. And I was like, oh, okay. So as a nurse, you're really going to be coming into contact with those infectious pathogens. Like, you're going to be caring for patients who have the flu, MRSA, they may have tuberculosis, or they may have like the flesh-eating bacteria. And by the way, I remember the first case I had ever seen of that, and it was very gruesome looking, and it was on the arm, and all you could see were the tendons and the muscle, and the flesh was completely gone. So as a nurse, what you want to do is you want to always follow protocols, make sure you're wearing the proper PPE, and you're being proactive. But sometimes you can follow all that, but you're still going to catch something like a cold, pneumonia, or something like that. Okay, so that wraps up this video on the 5 biggest job hazards of the nursing profession. And I would love to hear from any of you all if you've experienced any of these hazards. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.